Carissa, whenever you're ready.
All right, thanks so much everyone for taking the time to listen to our conversation and our presentation today. I'm here with Dr. Lisa Shinder, who is an alum from North Central University and does very important research on COVID, among many other things, heading up many trials. I can let her speak to that a little bit more. I'm a professor at North Central University in health services, and I do research like this as well. Lisa, do you want to share a little bit?
Yeah, hi, I'm Dr. Lisa Shinder. I work for a big hospital and I do clinical research. I am a clinical research coordinator and one of the lead coordinators on COVID studies that we're doing here at the hospital. And as she said, I met Carissa as my dissertation chair, and I'm an alum of NCU, North Central University.
Yeah, thank you, Lisa, and we're fortunate to continue our research and work together.
For sure.
Yes. So, all right, everybody see the slides okay still? Okay, so just the disclosure slide that this was funded partially by North Central University. The purpose of our study is to develop a socially distanced instrument and design to determine changes in physical activity and stress levels pre, during, and post our COVID-19 pandemic. So as we are all living right now, and let me get this in slideshow. Sorry. My cursor doesn't want to work. Okay. All right. Well, I guess I'll just go from here. As we're all living the stay-at-home mandate, we know that we're only to leave home for the essentials, such as groceries, medications, but we are very much encouraged to get out and get physical activity. So what is unknown about this is that people are actually displaced from their routine physical activity, or, you know, if in fact there are more people out in the parks, we know that there are more people at the parks, but are there more people getting physical activity? We also know that people are going out in smaller groups, and they are staying closer to home, only going about 2 miles away from their homes. We also know that the requirements or the recommendations for physical activity have not changed, and that's because there are many protective factors in strengthening our immune systems to actually fight off COVID-19. And if this physical activity is done outdoors, there's additional benefits from absorption from vitamin D, and then protection against other chronic conditions that weaken the immune system. And I needed to acknowledge here the American Public Health Association Physical Activity COVID Task Force. These folks have really jumped in to put together peer-reviewed research that has been in place, that's been published, also white papers and blogs, and just gathering safe physical activity recommendations for APHA at large, but also the general public. And here I just want to go through some of those recommendations. You can see this from the World Health Organization, recommendations about how to stay active while at home. Then we have recommendations about how to stay active while working from home. And parks have been very active in creating signage, increasing patrolling, putting together very helpful guidelines in making sure that folks are safe when they do access their parks. All right, and even our partner, Cleveland Metro Parks, you can see some of their signage here. And we know that folks are actually following a lot of this, you know, going out in those smaller groups and making sure that parking lots are not full when they decide to actually visit a park and things like that. So our partner, Cleveland Metro Parks, has agreed to recruit participants through their Community Pulse, which is an online research panel of 3,000 Northeast Ohioans. So we're very excited about that. And I'll let Dr. Shinder take it over from here.
So we're going to talk about our instruments and data collection. Our participants were asked to and will be asked to download an app that will share data. They'll complete a before and during survey, and then a post survey, and then we're looking to do a follow-up interview. The participants will enter physical activity from their phones and fitness devices. And they'll also do a self-report on their activity mode and location. We also have included questions about the changes in childcare and their employment. And then we're going to create and use a code that will link the before and during to the post and the follow-up interview. And then we have additional instruments that have been tried and true. We have the International Physical Activity Questionnaire, the Rosenberg Self-Esteem Scale, which is a mood questionnaire, and the Positive and Negative Affect Schedule, which is another mood questionnaire. And then for our analysis, we will use the SPS software to calculate both the descriptive and the inferential statistics. And then we've also added Google Analytics, which will be used to compare park use. And then our preliminary results are the Google Analytics showed an increase of park use over 150% since the at-home mandate was put in place. And then during our field testing of the instrument and the procedures, it was actually determined that this survey will take about 15 minutes. And then we did determine that linking to a device such as a phone will be optional. Our limitations and delimitations, for those participants that can use a device, that's great, but we're making it optional because it could bias for people that don't have the ability to have those devices. Also, participants may be more motivated to exercise knowing that they're going to be tracked. And then self-reported and fitness tracker data could have the potential for a richer context to how physical activity and the mental health is affecting people during this COVID-19 pandemic. And that will include the child care and the employment factors. Use of phone applications can facilitate the sharing through and give us the ability to, with the device sharing, compare the self-reported data, and that'll increase validity. We also are submitting for some grants so that we could offer potentially a $50 gift card as an incentive during the pre and post pandemic to help increase our response rates. So really the goal is we're trying to gain a better understanding how participants can best report physical activity and stress levels by promoting improved immune systems, reducing stress, and incurring other physical benefits of exercise during this pandemic. The goal is really to provide the public health and healthcare sectors, both with a socially distant design as well as data to better prepare to keep populations active for any future stay-at-home mandates. Thank you. We appreciate you guys listening.
Thank you so much, Carissa and Lisa. We now have some time for questions. If you want to chat your questions in the chat box, which is on your screen on the bottom, or if you just want to open up your microphone and ask your question, you are welcome to do that. So I'll open up with the first question, either Carissa or Lisa. I'm wondering, based on previous studies, and I'm sure you've done a literature search on some previous studies, what kind of results do you expect to be able to get from what you're going to be doing?
So, you know, we've never had an experience quite like we are all living right now. So, you know, that's what we've really seen so far. So I think it's going to be interesting to see. You know, we know the response rates from this particular group of panelists tends to be pretty high, over 20%. I think what's going to be interesting and what we are hoping to be able to get some responses with is using this app. So I've seen it done in different ways from some other physical activity studies during COVID-19. And I think we are all kind of struggling with the best way to have folks link their devices. So I think that is one of the really important results of this, is just seeing, okay, do we get response rates from the survey, from the self-report, and then what kind of response rate do we get for people actually linking their devices and participating in the study that way. And then in terms of results, it's hard to say because, you know, it appears in our neighborhoods and we know in our parks that there are more people out there being active, but we just don't know if it's just all of these people are going to the only places they can go, but they would have been at YMCAs and parks, you know, even at their workplace facilities as well.
That's a really good point, yeah. So Dan has a question in the chat box. It's, do you know who is included in the sampling frame population? And also, do you know how the parks created their sampling frame?
Well, I know that they recruited folks for the community pulse, but the short answer is no. You know, I definitely will need that information, and Lisa and I will need that information moving forward so we can speak to any potential bias from that group of people and how it might impact results.
Excellent. Are there any other questions from the audience?
And Lisa, I don't know if you have things to add to either of those questions.
No, you did great.
Okay, why don't we transition to the next